Hello everyone, I hope you are all very fine. Today we are going to discuss our next topic, which is about common anticoagulants used in laboratory. Before going into the anticoagulants, first let's understand that what are the methods of blood collection, which is a primary important topic to discuss. Then we will understand what are various blood types such as venous blood, arterial blood and capillary blood. We will understand what is the basic difference between these three, and at last we are going to understand various types of anticoagulants used in laboratory. So the patient's specimen, whenever we are handling any specimen in which the majorly you will all as a PGDMLT students will handle a blood. So if we talk about any specimen in PGDMLT laboratory or paramedical laboratory, they all should be properly labeled, and the reason why it is properly labeled in a way, because sometimes it may happen, or in previous times when there was not much of the knowledge or this kind of awareness was there, sometimes what happened was the mismatch was happening too much, and due to that reason the samples may be crossover and mismatched with the same name persons. Like in some conditions it may happen that the same name containing person may visit your lab, such as his name is like Rakesh. So Rakesh can be multiple person having the Rakesh name. So you cannot label the Rakesh name in the test tube, or you can say vials. So you should also mention few other things along with the name, such as you can incorporate the parameters like age, his surname. So this becomes now three parameters: name, surname and age. Along with this also, you can also mention the test names, which is a common procedure used in the small scale lab. When we talk about in the medium scale laboratory or large scale laboratory, they follow barcode system. So there is a very low chances to get the mismanaged labels, and some of the laboratory also use the registers nowadays in order to reduce the risk of mismatching the labels, or we can say samples. So usually at that time when they are using registers and the computational barcodes, they use the patient's ID or the sample number. That will make it easy to detect or guide the patient's sample to the particular laboratory testing. So the blood collection can be done from these main three locations, or we can say sources. The first is capillary, venous and arterial. So let's understand what are the basic differences between these three. So the first is capillary blood collection. Whenever you heard this kind of terminology such as capillary, the basic meaning of this capillary is usually a relative size of the vesicles which provides the uh, blood to your body parts. So in a way, you can consider these capillaries are a very small molecules, even smaller than the veins. So it is usually a collection technique which can facilitate the estimation of routine hematological parameters, which consist of platelet count, sedimentation rate. Sometimes you may have seen the laboratory technician taking the small capillary blood from the patient for the glucose estimation as well. That will be done in the glucometer, right? So that is also done for the routine test. because the amount of sample which is required is very low. Only few of the tests can be done from the capillary method. Also, this method is not widely we can say accurate. It may consist of some of the variations or errors because the amount of the blood is very low. Sometimes you may be able to take some amount of sample, and sometimes it may happen that the it requires a pipette, specialized pipette to consider the amount. Sometimes it is also taken from the capillary blood collection in the patients of cytotoxic agent therapy. This method is widely used for the routine purposes, and in which a very small amount of blood sample is required. Such as if we talk about, I think UHC and PSC centers are mostly using this kind of techniques of blood collection. So this is the picture which shows the capillary blood collection, in which you can see this is the capillary, and this is the edge of the hand where the small amount of prick has been done, and it is some amount of the blood sample is taken from the finger. So basically you should understand that from which finger it is taken, the blood sample. Usually it is taken from the ring finger of the left hand. The reason behind this is the whatever the pipeline or the capillary which connects to the whole body is just stop till the left hand shoulder, and in case of any infections or something that may happen at the time of needle pricking or sample collection, so it can be we can say stopped because the vein or capillary which is connected to the left hand ring finger is just extended to the left hand shoulder and not throughout the body. When we talk about venous blood collection, it is mostly used technique for all the laboratory technicians. Usually they are taking this blood for the various purposes. In this, they directly puncture the vein, most often located at the antecubital fossa area of the arm. In next upcoming slide, I will show you which location is called as antecubital fossa, and it is located in the arm. Also, this kind of sample can be taken from the back side of the hand, or we can say back top of the hand. In other types of collections, the venous blood may be also obtained using vascular access device. This device will help focus, or we can say visualize, the central venous pressure lines, or we can say an IV stat. So I will also show you this device, that how it looks like. So this is the basic procedure of blood collection. You can see in this figure it is showing that how the angle should be kept for the blood collection, and what are the basic precautions that need to be taken while you are doing the blood collection, in which the first precaution that in this figure is showing is they have wear the gloves. Then the tourniquet has been placed just above the collection area. Usually this tourniquet should be placed above the four fingers above the collection area. Okay, so there should be a 4 finger distance between the sample collection site and the tourniquet. And also the tourniquet should not be too much tight or not be too much loose. So it is kind of appropriate or enough tightly packed so that you can easily retrieve the blood. So this area, which is kind of you can say there is a whole type of structure a fossa type of structure which is called as anticubital fossa, at where the multiple veins are located, from that from where you can take the sample. Now, if in some cases it is very hard to take blood samples from the antecubital fossa, or sometimes some patients such as diabetic patient, or patients having the higher fat value, or fatty person, obese people, it is very hard to take blood from this area. So in some cases we can also take the blood of, we can say, venous blood from back of the hand as well, and this procedure will also be similar. The only difference will be that we will tie the either thread like structure, or we can say tourniquet, just above the two hands away from the collection area. So these are the materials or equipments that are necessary to perform venipuncture, or we can say venous blood collection. First and foremost required material is gloves, because in some cases it may happen that we don't know what the person is suffering from. The patient may be suffering from various diseases which can eventually infect the laboratory worker or the phlebotomist. So gloves is without hesitation any, it is very necessary equipment. But yes, uh, the important thing about this is it should be well fitting, and it should be non-sterile. Second is all the lab workers, or we can say phlebotomists, should carry out the hand hygiene before and after patient's procedure. So in some condition, if you are going for a blood collection, your hands must be cleaned before that. You may clean your hands by washing the hand, or you can directly sanitize it with using sanitizer. And the same thing will apply after the blood collection. Also, for yes, here it will be sterile gloves that will be required. Non-sterile will be the wrong word for here. And there are multiple sizes of gloves are available. Whichever fits to your hand, you should wear that. Not too much loose, or not too much tight gloves you should wear, because otherwise it may be, broken. Next time, the syringe is very essential thing for collection of the blood. Here, the syringes comes in a various types, such as in terms of how much ml of the blood you want to collect. Accordingly, many types of syringe are available. Secondly, the one another different, or we can say unique type of syringe is also available, which can contain the butterfly needle. So I will show you how the butterfly needle works and how it looks like. But other than these all things, second thing which is required are needles. Then this hub, this is called as hub, syringe hub, and various vacutainers, we can say anticoagulant tubes, then alcohol wipes, bandages, or we can say tape, then gauze sponges, or we can also call it a spirit having the 70% ethanol, then tourniquet, then sharp containers, and requisition form, and other swabs and wipes. So the tourniquet is the device which is called as the tightly thread-like structure, which we kind of call it as a belt, but it is not the right terminology, because it should always be called as tourniquet. So this device is used to create the pressure towards the hand. Then multi-sample collection needle. This needle can be used for the multi-purpose, because one example I will provide, that is butterfly needle. In just upcoming slide, I will show you what this looks like. So there is this concept of needle gauze. However, it is little bit confusing, but in case of you want to find out which tip you want to use, you should know this concept. So first, the gauge size of a needle indicates what's the diameter of the lumen. Lumen meaning the opening of the needle. So the opening of the needle may be a very wide or it can be a very narrow. Depending on that, it is reversely connected, like this needle gauge is. As the higher the gauge is, the smaller the diameter of the lumen. That means, for example, 30 gauge, if we call it a 30 gauge needle, then it has the narrower lumen, or we can say opening, than the 25 gauge needle. So, whenever we reduces the gauge size, it becomes more and more wider. Then different companies uses different measurements, but some are very standard and that can be used for multi-purpose. So, for 18 gauge needle, which are most commonly used for the blood donations, because in blood donations there may be a large amount of blood which is required to be collected from the patients. So, 18 gauge needle is used. When there is somewhat uh, smaller needle size, such as 21 gauge needle size, which are commonly used for the routine blood collection or venipuncture, then for most patients, because they possess a wide veins enough to fit into the 21 gauge needle, so it can fit comfortably. Additionally, if the needles are not large enough, then what can happen that some blood cells may be shrinked when we try to take the sample from the patients. So it's essential to use 21 gauge needle, which is enough and it can fit comfortably. Another size of needle which probably can be asked in exams as well. So 22 gauge needle, which are used on the patients which are having smaller veins. In infants and children's, because they are having much thinner veins than the average adults, they for them we have to use 23 gauge needle. Okay, because they are having very small, relatively small veins. Again, the next point is telling us that particularly those with chronic illnesses, such as the illness which usually last longer, for them and the other patients which are having thin arterial walls, we may have to use the different kind of needle size depending on what the conditions are. So, needles which are smaller than 23 gauge are potentially damage red blood cells. So, basically we cannot use the needles which are smaller than the 23 gauge needle, especially for the routine purposes. So this is the basic phlebotomy procedure we do on the butterfly needle. So this is the basic photograph that you can see, and you may have seen this butterfly needle in various laboratories. This butterfly needle has the basic structure of the syringe as well as the one holding capacity, or we can say space for the vacutainer to get in. Similar procedure we should apply on the butterfly needle. As you can see on the right hand side image, the vacutainer will be going inside the butterfly needle, and we can directly collect the blood from this side of needle, and then it will directly go into the vacutainer vials. So in whichever vial you want to fill up the blood, you can place that vial inside the butterfly needle and you can take out samples one by one. Let's say you have to fill up the vials of EDTA and plain vacutainer, then you can first take the sample in the plain and then you can take the sample on the EDTA accordingly. Now, this butterfly needle will help patients and lab technicians to minimize the risk of exposure to the outer environment. So, blood can be exposed to outer environment when we first collect the blood in the syringe and then we transfer it to the vacutainer. So, it's kind of a three-step procedure, but it can be minimized to just one step by using the butterfly needle. So again the same procedure will be applied. The first tourniquet will be applied on the upper arm, then the sterilization will be happening at the location using sterile spirits, and this is very important procedure because many of the lab workers do this procedure very wrong. So whenever you are applying the spirit on the antecubital fossa, how should you should apply is it should apply it like this in the outermost circle way you should go for the cleaning purpose. Then next step is to visualize and palpate the vein. Once you either visualize or feel the vein, then you should enter the vein, but you should not enter the vein directly and vertically, because there is some physics will be work which will work to get into the vein. Okay, that let's see how the angle works. So this is the basic photographs which can show the angle and how the blood collection procedure takes place in the current situation. So the first step, whenever you have applied the tourniquet, the next step is to fix the vein. Once you have palpated and located the vein, the next step will be to fix the vein. Once you fix the vein, there are very lower chances to get that vein fluctuating whenever you are getting into the vein with the syringe and needle, right? So then the next step will be the inserting the needle with this needle bevel up. So always try to keep this portion upside, and that which you can visualize at that upside, right? And the next step is to draw the blood accordingly. Whichever blood tests are required, you can fill up the vacuum according. And then first of all, whenever you enter the needle into the lumen into the the muscle part or vein part, you will see a red dot on the this portion, and then you can understand that the blood will now flow through the needle, and then you can just push the we can say just collect the samples. Now, this whole procedure contains the very smooth functioning, and this probably cannot be understood, or we can say developed by the theory only. So you may need to practice this on the lab. What precautions we need to take? So whenever you are doing the venipuncture, that area must be cleaned and sterilized properly. Otherwise, there are the chances of patients getting infected with the surrounding uh, impurities. Next, the tourniquet should not be applied for too long, such as more than 1 minute. So there is a standard procedure to collect the blood. So in that procedure, you should not apply the tourniquet for more than 1 minute. Okay, otherwise it will do something like this. So this is one new technology which can provide us the visualization of the vein inside this skin layer. So we in some patients, it is very hard to visualize the vein because they either have the very smaller vein, or you are not able to get the vein or locate the vein. At that time, you can use this device to visualize the veins. So now this figure provides the different kinds of veins which are present at the antecubital fossa. So the first vein name is cephalic vein, second one is basilic vein, and the third vein name is median cubital vein. So any of from any of these vein you can collect the blood sample, but you should make sure that the blood will easily flow out. Second figure shows the back top of the hand, in which the dorsal venous arc are present, and veins which will be working here present here are dorsal metacarpal vein and capitular veins. So from both of the vein, any vein you can consider to collect the blood sample. So this is the same figure which is shown previously. This shows the vascular anatomy of the arm, showing the antecubital fossa. This is again the similar figure showing the back top of the hand, showing the dorsum of the hand, where also basilic and dorsal venous arc and cephalic vein meets here. And in very rare cases, apart from these two, like antecubital fossa and dorsum of the back vein, you will require to collect the blood from. So this is very rare condition where you will be taking the blood sample from the femoral vein. So basically the femoral vein is located in the legs, specifically the femoral vein, which is a deep vein, is a very large vein, meeting here at the drop of the leg, where other types of veins can be also found, but this is very rarely taken site. Another vein from where you can take the sample, but it requires very precision and experience. As you can see, the location is very sensitive. So this is called as external jugular vein. From this location also you can take the sample. The another example is a scalpel vein. From this location you can also take the sample, but not you. I think the experienced physicians can take the samples from here. As you can understand, this is a very we can say sensitive parts. So in this figure, it is showing the fixation of the vein, where the arrow shows the pressure, where you should apply on the bottom of the collection site with using fingers. This will stabilize the vein at the one location, and it will minimize the movement of this vein. And then once you have fixed the vein, then you should add the needle in a way which is having around 10 to 30 degree of the angle. So this is the arterial blood collection. This actually part will the last part of today's session, but an important and we can say connected part to the venous blood collection. So currently we have seen the capillary blood collection and venous blood collection. However, the arterial blood collection is also an important, but it is mostly used to determine the arterial blood gases. So before going into the we can say uh, move further with the arterial blood collection, first you should understand is what is the basic difference between arteries and veins. So that I have explained in the further slides. So first focus on who can take the sample from the arteries. So first of all, this procedure can only be done by the health workers who have legal scope, and they have practice in and experience in this position, and they show a very proficiency in this position and in this technique, and they should be having a formal training. So arteries and veins, what are the basic difference? So first of all, arteries carry blood away from the heart, and veins carry blood towards the heart. So this is the basic difference between arteries and veins. Arteries carry oxygenated blood as they are taking the blood away from the heart, when veins carry deoxygenated blood. So this is the reason why arteries have thick walls and veins have thinner walls. Now, what is the choice of the site? There are various sites of arterial blood collection, but the first choice is radial artery. Second choice can be branchial or femoral arteries. Okay. So this all tests can be done in the arterial blood gases. because our syllabus do not emphasize more on the arterial blood collection, because in practice of paramedical also you will not encounter this test very often. Okay, so in this next lecture we are going to see few common anticoagulants which are used in the laboratory, specifically these five and a few more related to this. So till then, let's meet in the next lecture. Let me know if you have any questions in the discussion section or comments. Thank you.